All right, so this is a birth injury 25 years ago. He's had a tight SCM ever since they did a forcep, actually a very quick forcep and suction cup delivery because his heart rate went down, so they had to save him, or they're worried about losing him, so they really pulled hard. Ever since then, he's had a tight SCM on the left side that nobody's ever done anything about. Every time you bring it up, they don't, and actually kind of thank God that it's better you live this way than if they did cut your SCM or do something back then. Because now, as we look at it, our first thought is Botox to fix the SCM. We adjusted your atlas today. You got some relief. You're able to drain better. But still, the space occupying lesion is this gigantic SCM on the left side. So we know about torticollis. We know about cervical dystonia. There's even FDA approval for Botox in the SCMs for those things. But I guess we're going to call yours subclinical, which may not be the best explanation of it, but your head was not turned. Your head was able to be in the neutral position. You just had this huge SCM. Okay, so here we see evidence of it. So we see the contrast going through the right jugular vein, and we see no contrast going through the left. We see your external jugular superficially here, and that's the only thing that kind of gives us a tip off right here. And of course, this entire space is being occupied by the SCM muscle. So that kind of helps it. Right, look how large that is, and then comparison to the other one. You can see your jugular transparent, there's nothing there. And the anatomy books, and we can pull that up to show you that the outside of the SCM is bordered by the external jugular, and the inside of the SCM is bordered by the internal jugular. So just by looking at where the contrast goes, we can get an idea of those borders. Now, we did have you turn your head to the left and the right, and there's no getting away from it. That left SCM is so hypertrophied, so large, it's completely taking it's putting so much pressure on your jugular vein that there's no drainage really on that side. Very, very little. And you know that when you're driving or having to support your neck through space as any forces, this SCM tightens up, and the symptomatology is this brain fog and this pressure in your head that you've had your whole life, 25 years. And it's positional. You can kind of get away from it a little bit by lying down, and whatever it is to get this SCM to relax has been the only thing you can do. And then even when you turn your head to the right, you can see how much, there's no getting away from it. It's just huge. In comparison, very good idea. Compare it to the other side. Right. Let's see here. So that was the arterial phase. And there was another finding here where we found the styloid growing towards the internal carotid. And you can see it kind of in here because there's no jugular. But tell you what, let's look at a venous phase here. So we did another pass with you a few seconds later. So here we can see, there you can see your borders a little bit better. So this is slowed. We did the Doppler on it today. Very slowed drainage from there. It looked like after we adjusted you, it opened up a little bit. You could tell that you're draining better, and you were 50% better as far as the drainage right there, which we like. But really, it's you know what? I'm going to remove the external jugular so you can see this. So it looks like it's being pulled like taffy. There's the internal jugular, the atlas is digging into it, and really it's being bordered by this SCM that's dragging it across there and occupying space. And actually, with this tight SCM, it's doing an interesting thing to your brain. There are other muscles that are going to be inhibited because of it. And here we look at let me clear it out a little bit. The right jugular, there's a narrowing in through here on the front. So the atlas is bordering it on the back. There's something in here, I want to call it the SCM, or maybe some swelling or something in there. Even when you jut your jaw forward, And let's see, here we go. Even when you jet your jaw forward, there's still something in there, narrowing it. So it depends on what doctor you get in front of. Some doctors will want to put a stent in there. I think the doctors that remove styloid processes, I've got experience with those guys, and they'll go in there and they'll look for anything that's bordering the jugular vein and occluding it or narrowing it. We've seen nerves do it. I'm sorry, they've seen nerves do it. They've seen arteries wrapped around doing it, and of course they've seen styloids. So there are some very famous doctors that'll trace all the way down and release it the whole way. Omohyoids, posterior belly digastric. These are the things. So your intense brain fog, your pressure in your head, and the nervous system's not going to like that. So one would expect you to be, I'm not going to say neurotic, but you know, your nervous system's wound up pretty tight. Your parasympathetic is going to be overridden. We know that they get pretty good results by injecting the stellate ganglion just to stop the sympathetic override with people to help them get over PTSD and all kinds of things. And really, it's a mechanical problem irritating the sympathetic nervous system somewhere. And with this vascular compromise, you could have a whole bunch of symptoms. But look how that's being pulled in there. Tell you what, I got some still shots that I've got here. Oh, that was the other thing. We did notice that the internal jugular vein seems to be pushed back and forth depending on head rotation. So this SCM is so hypertrophied, it displaces it. This is left head rotation. You can see where it is relative to the transverse process. And let's see if we captured it very well. There's another shot of it. And you can see how it's very wispy thin. It's being distracted and tractioned. Different location on the transverse process. Oh yeah, here's the textbook showing the SCM being bordered by the external jugular and internal jugular. And you had a therapist say that the clavicular branch of the SCM was the most hypertrophied and the most contracted and staying in a contracted state. And we're seeing that too, but we see the whole SCM lit up or occupying space. Another view. You know, we went ahead and measured the distance, trying to document this thing. I mean, I really appreciate you coming a long distance here to teach me something new. These birth injuries that people have their whole life. There's a saying here in primary care that if one doctor misses or doesn't do their job, then the rest of the doctors are set up to fail because they're not going to catch it. Everybody has to do their job. This is a nice shot of the venous drainage going down through the spinal column or the spinal canal because it's so backed up. Another shot of it having to drain there. So the venous drainage is really, really significant, or the compromise is significant. There's that shot of that styloid making contact with the internal carotid. If it's giving you any symptoms, I'm not really sure yet. It's something to monitor as it grows. Actually, we don't want that to grow, but they tend to grow. Internal carotid, there's the nerve fibers around the internal carotid. There we go. And I think that's pretty much it. I'm just showing all the good pictures of this venous congestion. Anything you want me to talk about? There were lots of things that were normal, that were not ridiculous. I mean, no hypermobility, pretty much. I mean, a little bit here and there. And I mean, we just took an inventory of everything we could find on you. So really, there's not much else to really talk about. Anything you want me to say? Anything you want to say?
Clear.
Okay.